Just wanted to update you on several issues, specifically as it relates to budget. We've identified the puzzle pieces and have been working to complete that before the end of May. That work continues, and I think we are on track to hopefully have a budget agreement earlier in May rather than late May when it normally is out. But great work that's been done by the members of our caucus and the working groups to pull together the information for our members to be able to start identifying all the options, and then now obviously the challenging part to start putting that puzzle together. Obviously, the big issues that are out there, probably the biggest, is the provider rates and access to health care across the state. We have had a great deal of discussion in our caucus about the Insure Oklahoma plan and moving 350,000 people to private insurance, moving 175,000 of those off of Medicaid and to private insurance, and then insuring another 175,000 Oklahomans with private insurance. So a significant issue for the state, and we think that's obviously a plan that there's a lot of interest for a number of reasons. One, the crisis in many of our hospitals, particularly in rural communities, and ensuring that there continues to be access in those communities, making sure we keep enough providers in the network to serve those in the state that need that, and that's critical to make sure that we have providers in the system. Obviously, for nursing homes, mental health coverage and care for many of those people that don't have insurance that would be available under that plan. And then ultimately, the cost savings to the state, $700 million of cost savings to the state when the plan is fully implemented. And so those are all things that we are very much aware of, and probably one of the top issues to deal with in the coming weeks of this session. Representative Peterson obviously had several pieces of legislation passed out of the Senate that are on the governor's desk on criminal justice reform. And she's done a great job spearheading that effort for us as our criminal justice chairman in the House, and also on the legislation that she's been working on. And we're really pleased that those measures are headed to the governor. Some of those ideas came from the governor's working group. I have two bills that are still here that are in conference that the Senate has passed and will go to conference now, that require supervision for and a parole hearing that would then ultimately require supervision for those who are incarcerated on 85% crimes, so that they're not just released with no accountability, to ensure that aspect of public safety. So that bill that I have is still alive, and then also the bill addressing fees and providing some reductions based on time served minimally, and then also payment plan options for those that are leaving prison. That's one of our biggest challenges, is these offenders leave prison and they owe all this money, and then they miss a payment and a warrant's issued, they get picked up for something, and they're back in the system because they couldn't make that payment. And so there's some things Oklahoma County has done that we've looked at that would allow a 6-month grace period for someone to get on their feet, to get a job, to get a car, to get a place to live, those types of things, before they then had to start paying what they owe. And actually the ability after 6 months, if they're not in a position, to go to the judge and make the case for why they need an additional 6 months. So those bills are both still alive. They are headed to conference. Title is off, but they've now passed the Senate. I believe both of them have now passed the Senate and are headed to conference. So an issue that the House has been working on for years. I mean, literally several years that the House has been working on this issue, and finally now, with the support from many of the stakeholders, I think people are realizing that we have to do something different than what we've been doing, and we have to have a solution to reducing our recidivism rate and the number of repeat offenders. Obviously, a great deal of interest in reducing the crime rate, and to make sure that we have the bed space to lock up the violent criminals that we are afraid of. And obviously, with our prisons at about 122% of capacity on any given day, that's an issue. On education issues, obviously the House has already stated that any reductions to our public schools, our pre-K through 12th grade schools, will be no greater than 5%. We are still working to bring that number down to have an even smaller reduction necessary for schools. But we have obviously made that commitment, which does mean probably some larger cuts in other areas. But I think that's an important commitment. We're going to continue to fight to get the lowest cut possible in the budget environment where we find ourselves. We have working groups meeting on testing reform, and some of those bills are moving through the process, but that's a significant issue we're working on as well. And then obviously the $51 million that went from our state savings account to schools to help address their current funding needs as well. The seismicity bill, the governor signed House Bill 3158 this week, which I think was an important thing to get on her desk as well. It removes any doubt about the Corporation Commission's ability and authority and powers to deal with wastewater disposal volumes or other issues that they need to address induced seismicity. And really excited to have that on her desk and make it very clear that the Corporation Commission has the power and authority to do what they need to do. Again, believe that they've been taking appropriate actions, but this just ensures that there's no doubt in terms of challenging their powers and authority. And then lastly, mental health reform. Yesterday, I think, was very significant. Of course, it was Mental Health Day here at the Capitol as well, but to have House Bill 1697 sent to the governor, the Mark Costello Act that would allow families to work with local authorities to make sure required medications are being taken, a major and significant piece of legislation, and was very important. And I'm really pleased to see the House pass that bill as well.